we know that it's not enough for us to be the super voters. We have a plan for everyone in our lives. Democracy is not just about voting, it's about making sure that every one of us has a chance to live a healthy life.
That is how we can improve our democracy. That is the energy that we need to bring to our elections, to bring to our voting.
Our first session this morning is the role of democracy in shaping Black health outcomes, fitting during an election year. I would like to welcome first Ambassador Norman Eisen to the stage. The ambassador is retired, but he is representing the State of Democracy Defenders Fund. He's also a senior fellow at Brookings and a leading expert on law, ethics, and anti-corruption. Known for his analysis on the trials of former President Donald Trump, he frequently comments on CNN and the New York Times, and he played a key role in Trump's impeachment and served as U.S. ambassador to the Czech Republic. Also this session, we have with us Allegra Lawrence Hardy. She is a powerhouse litigator known for her innovative thinking and tenacity. Allegra has defended Fortune 100 companies globally and co-founded Lawrence and Bundy, which is a boutique commercial litigation firm. In addition to being a leader in the legal profession, Allegra is also a prolific author and sought-after speaker. If you guys could try and keep it down a little bit. Again, our speakers, Ambassador Norman Eisen, Allegra Lawrence Hardy, and the subject of this session, the role of democracy in shaping Black health. Dr. Eisen, do you want to get started?
Thank you, thank you, thank you. Wow. You know, Allegra, they had to pack this room with energy to get ready to hear from two lawyers. I think it's cruel that you all haven't had your breakfast yet. You got to hear from the lawyers. So we want you to, because it's very important to health to have a good breakfast. So don't hold back on enjoying while we talk. And I have to say, I loved the beginning of this conference. It was better than I'd go to a lot of conferences. Let's give Ross Daniels a big hand and I'm getting that musical artist to do one of those tracks for me and Allegra when we go around. I'm not joking. When we go around the country talking about democracy. So we know you're excited to get to this topic. It is a very important one. We're very honored to go on after Yusuf Salaam because he was one of the first to see the danger to our democracy represented by the orange one. He was one of the first, and we talked about that backstage. All right, Allegra, let's chat with our friends on the topic of democracy. It's on everybody's mind 80 days before an election.
80 days before an election. So why are we here to talk about democracy and voting when you're here to talk about Black health outcomes? Because we know that there is a direct impact on our income outcomes, on what happens in our community and our healthcare based on democracy. So we're going to spend a few minutes talking with you all today about how democracy is necessary for maximizing Black health outcomes. We're going to talk about how the democratic process itself affects outcomes and the relationship between voting and Black health outcomes. We'll talk about how democracy affects our society, which of course impacts our direct access to health care. And then we'll talk about what may or may not happen in 2025 and beyond based on the outcome of this election. So let's first talk about democracy. It's not just voting, although as Norm says, with 80 days to go, voting is on all of our minds. I know, I saw that line out here this morning, so I know everybody here is already a super voter. Am I correct? I could tell when I walked up. I was in a room full of super voters. I love it. But we know that it's not enough for us to be the super voters, right? We know we have to make sure we have a plan for everyone in our lives. And I mean the young people, the not young people, the people you encounter on the street, to have a plan for voting. Why? Because democracy is not just about voting, it's about making sure that every one of us has a chance to live a healthy life. So these are tools, of course, that impact our health. First of all, representation, so incredibly important, right? In a democracy, we get to elect representatives who understand our unique health challenges, right? You just heard from a city councilman who you know understands the health challenges we all face. His family has engaged and dealt with those health challenges. If we want our leaders to know why it's important that diabetes medicine be affordable, for example, or why it's important that we can have the COVID vaccine, for example, why it's important that breast cancers that affect Black communities in a disproportionate number continue to be available, and that those treatments are invested in research, we have to tell our representatives. We also get to advocate, right? We have to advocate through the democratic process for these specific policies and for leaders who support our policies. Democracy also provides a framework for all of our civil rights in healthcare. We know about health disparities. We know about all the ways in which healthcare policy can discriminate against Black and brown communities. And so this gives us an opportunity through democracy to advocate for those changes. Democracy also allows for some accountability, right? We get to actually hold our public officials accountable so that when they're doing what we need them to do, we can reelect them. And when they're not, we vote them out, right? We vote them out. It allows for transparency, allowing us to understand what the government is and is not doing on our health care. It allows us to be engaged. Democracy allows us to participate in local government meetings, to show up and march, right? To sign petitions, to do all the things that I know the people in this room do to advocate for the health care for our communities. And of course, Norm, voters get mobilized, right, around
That's
this
what
process
we need.
to engage in democracy.
We need that voter mobilization because that is the foundation of American democracy. With all of its ups and downs, with all of its imperfections, allowing Black communities to influence the election of leaders who prioritize our democracy, who prioritize genuine American values, not the fake version that some people are pushing, and who prioritize Black health. That is how we can improve our democracy. We can take another step towards the as yet unrealized and imperfect vision of where we want to go as a country. Voter mobilization efforts ensure that issues like affordable health care and health disparities are front and center during elections. And if I could go back to the last slide, I want to show you that graph, because what you see here is the correlation between democracy outcomes like voter turnout, same-day voter registration, voting by mail, and restoration of voting rights to returning citizens. That's what Allegra and I work on together all day long, every day. We were just planning a new lawsuit backstage to fight for y'all's voting rights. That's right. But if you look at those virtues of American democracy, they actually track, if you look on the two sides of the line, they also track with health outcomes like infant mortality, availability of health insurance, self-reports on health and on mental health. And states that are more repressive on voting, including on black voting, like Mississippi and Alabama, where you have to fight harder. In those same places, Allegra and I have found that the health outcomes are worse as well. So you can see the clear relationship between democracy matters, voting matters, and black health matters.
That's exactly right, Norm. Thank you so much. And so now when we look at how the democratic process affects these outcomes directly, it's in all of these areas, right? All of these areas. And we know that this is all of the determinants of black health. Are we having, as the councilman reminded us, life in our years? Is there public health investment in our communities, right? Are you seeing it in Harlem? Is there health literacy and education? Do people know what they need to stay healthy? Do they have the tools, like the mammogram screening, right, that's happening here today? Do they have the tools that they need to stay healthy? Environmental racism. I come here from Georgia, and I can tell you that there are things that happen in our communities in terms of waste being dumped and environmental hazards that don't happen in other communities. We have to be able to use the democratic process to protect our family from these environmental racist factors. Gun violence, we can't talk about health without talking about gun violence and the way that it affects our children, our communities, right? Incredibly important. The economic disparities, particularly as we see them in housing and the way that that impacts black health. If you don't have secure housing, it's very hard to stay healthy. Mental health crises that we're all so aware of. What is the investment in our community on mental health? Maternal mortality, an incredible, incredible problem. It seems beyond belief that in 2024, we're still talking about this issue, yet we know it's as real as it's ever been for our communities, and that we need investment in protecting our mothers. And then, of course, Medicaid and Medicare access, right? Expanding these things, making sure they're affordable, making sure that all in our community have access to health care, because again, that is how we make sure we don't just survive, but we thrive.
So, what does that mean for each and every one of us? We have 81 days until the election, when, as you just heard from Allegra, we will elect leaders who will put these policies in place. And there's good policy, and then there's Project 2025. That's right. And Donald Trump is trying to walk away from Project 2025 because we caught him. He said the quiet part out loud. His advisors wrote Project 2025. He has endorsed and embraced Kevin Roberts, who's the head of Heritage that pushed Project 2025, and J.D. Vance, as I call him, Junior Varsity. J.D. Vance actually wrote the foreword for the book by Kevin Roberts, endorsing these policies. Let me tell you, they will not be good for black health. They will not be good for anybody's health, and they certainly will not be good for the health of democracy. And that is why we're gonna wrap up. We're gonna take a couple questions, so get ready. If you have a minute to ask a question, Allegra and I want to hear from you. But on issues like reproductive health access, Medicaid, DEI, fighting DEI is fighting black health. So on those issues, we need your voice. But we're not going to end, Allegra, with scary comments about Project 2025. No, because this summit is about uplifting what we believe in and what we work on together. And Allegra and I are so honored to be a part of it. Really, we feel the energy. I felt the energy when I pulled up to the Alhambra Ballroom and I saw the hundreds of people, and y'all waited. Here you are. That is the energy that we need to bring to our elections, to bring to our voting, to infuse our democracy with that power to improve Black health outcomes. So through representation, accountability, civic engagement, and voting, everybody voting, we're going to do that. Allegra, I'll give you the last word before we take some questions.
I'm just going to add, you already know, everybody in here is a super voter. I know that. I know that. Right? Because you were in line at 7:45 this morning. You're super voter. Right? So this is not just for you to file it away. I know my friends brought their notepad. They told me they were taking notes. You got it. Take your notes, but then let's figure out how we can challenge each other to spread the word. Because as much as we are all super voters, we all know people who are not super voters. We need to make sure the young people in our lives understand our health outcomes are in their hands. Right? What happens to us, if they want us to have life in our years, if they want us to survive and thrive as a community, we are putting ourselves in their hands. They have to be super voters too. They have to do whatever it takes to make sure that in 81 days, their votes are counted. And they will do it because you asked them to, right? So we're gonna all leave here with lots of things. We're gonna commit to our mammograms, and we're gonna commit to eating better and exercise and all the things. But one of the things we're gonna commit to each other on, oh, actually, let's just take a moment. And everybody turn to somebody next to you, to the right, and say, I commit. Right? I commit. I commit. You are committing. Go get your voters. You tell them, you don't have to tell them how to vote. You just make sure they know we are putting our future in their hands. We'll take any questions you may have.
Okay.
Yes, ma'am.
Good morning.
So my name is Crystal. And I'd like to thank the people who, every person that put this thing together. I want to say thank you. The sister that I think her grandmother died in the hospital, the main lady in the blue. I'm sorry if I don't have her name. Rosalind? Okay. I want to say this. When I was online, out of all these people, I counted 4 young people. And whenever we have activities in our community, it's always the over 50 crowd. Now, don't get it twisted, because I'm over 50 myself. But what we're going to have to do, just picture how it looked when you stood outside. Picture how it looked when we had to come in here. How the people who organized this thing tried to do it to the best of their ability. There should have been a larger venue. There could have been a larger venue. It could have been more organized, but the problem with us is we don't get involved. So now all of a sudden, you got Orange Man and you got what's called a black woman, and everybody's thinking she's the savior. Well, guess what? You walked through piss, through garbage, through homeless people. The list goes on and on that you walked through to get here. These are our communities. And until we realize that we have to get involved, all of these organizations that's out here, these housing projects with their tenant associations, and the list goes on, our community boards, and all of this kind of stuff, these people are at the table. I'm going to say one more thing. They tell us that if you don't have a seat at the table, you're on the menu. Well, guess what? Guess what? the people that's not at the table are the ones that's doing the work, because I'm one of them. The ones at the table get in, they don't deal with the regular people, they go to the so-called leadership. So, case in point, I appreciate everything that's taking place today, but we got to get involved. It can't just be the over 50 crowd. We got to touch them young people.
Miss Crystal, I think you agree with me, right? We need to get the young people out.
I would like to know if there is more advocacy regarding early detection when it comes to mammograms and cervical cancer. I just want to know if there's more of, if there's any, a lot of people are putting it where you have to be a certain age to go for mammograms. I was 27 years old when I found the lump in my breast. So I'm wanting to know if we're moving back the age of where you can go for that at early.
So I'll speak to that if I may, because I think a very similar issue with that is that women of color often need, and I'll just speak to my own mammogram, women of color often need a 3D mammogram, for example, to be able to really detect, right? So we need a different level sometimes of service. These are exactly the kinds of issues that we can address in a democracy, right? We take those to our elected officials. We take that to our different policy organizations. And that is why it's so important. So I agree with you. We have been hearing lots of suggestions that those mammograms occur earlier and earlier, right? Particularly when we have certain risk factors. But it is hard for some people to get them covered by insurance. And so what we can do, the reason democracy is so important is we have the ability to advocate for those changes. So I will be right there advocating with you. Let's just keep voting.
It needs to happen because, again, it could have turned left for me. I'm 53 now.
Yes.
And I'm thankful that, you know, I caught it when I did.
Me too. I'm so glad you're here to have this conversation. And such a reminder for all of us, right, to get our regular mammograms. Thank you.
All
right,
right.
we have time for one more last question. Last question.
I don't think the organizers, oh, you want us to do one last question. All right, last one.
I would just like to know, where can you go to get more information on 2025?
Oh, yes. We have, the question was, where do we go to get more information on Project 2025? And I'm going to answer that question and take advantage of the moment to thank you all on behalf of me and Allegra. I love the passion of those two questioners, initial questioners. I was very flattered to be included among the 4 young people in line. One of the very exciting things that is happening on the youth front is that Kamala Harris and Tim Walz are turbocharging the youth voters. So there's a moment now, and I'll take that energy we heard from our first 2 questioners and turn it back on y'all. You have that network. Talk to those young people. You're the network in this room. We talked to some folks before we came on. It's a nationwide network of friends and family. Don't only focus on New York. Reach out to your networks. This election is for all the marbles. Finally, to answer the very good question, where can you go to get that information? Right here in New York, New York University hosts a website that I co-edit, the American Autocracy Threat Tracker, and we break down all of the threats of Donald Trump, of Project 2025 and his allies, including the harms to black health and to all our health and the health of democracy. We're so grateful you had us here today. We're going to get our breakfast now, and we're going to hang around, come over and say hello. Thank you, Black Health Matters. Thank you, Harlem. Thank you, New York.